is 7:33. Let's talk about some of those new measures aimed at slowing the spread of the Omicron variant with the Care Minister, Julian Keegan, who joins us live on the programme this morning. Thank you very much for being with us. I feel like it's one of those mornings where lots of our viewers will be wanting as much information as possible. So what can you tell us, what detail can you give us this morning about the booster jabs, how they might be rolled out and to which age groups?
Well, OK, obviously we announced yesterday on the advice of the JCVI that booster jabs will be offered right down to the 18-year-old age group, so everybody from 18 and above. We're working on operationalising the plan right now, so in the next couple of days we'll tell you who'll contact you. Obviously the NHS will contact you. The booking system will be updating as well for the 3-month interval, and we'll also be advising people in cohorts when to come forward and, the overall plan of how long it will take us.
I'm sure, as you well know, I'm sure that, there's so many questions coming in. People are asking, can they book online now? Do they have to wait to be contacted, or will detail about that come out in the coming days?
Wait to be contacted for now, because the booking system we also need to update with the 3-month interval, which was advised by the JCVI yesterday. So it'll take us a couple of days, so you'll know very shortly. So wait to be contacted, and we've done this before. It'll likely be in age cohorts, starting obviously with the oldest people. We've done 17 million booster jabs already, so a lot of the very elderly and vulnerable are already boosted. But if you're in that category, continue to come forward. But then we'll be setting out more details of which cohort, and we'll open it up a cohort at a time.
Yeah, as you're right about the 17 million. There's 25 million eligible now. I mean, in terms of timescale, obviously things are being stepped up. But what are you thinking you might be able to, time-wise, you might be able to get through those other 25 million? Is there a date in mind?
Well, we haven't got a date that we've agreed yet, so they're going through the plan with that. But we will be setting a target, as we have done in the past. But we're pretty good at doing this, actually. We have the supply, we have people who are trained up, we obviously have lots of vaccination centres, we have the ability to do pop-up if we need to do more. So we're pretty good at doing it. We just need to give the NHS and the Department for Health just a day or two just to work out what they're going to do. But, we have all the ingredients.
Because at the current rate, if we're vaccinating at the rate that we're doing at the minute, then it wouldn't be completed that until the end of February.
Yes, no, I think we'll be trying to increase the rate from the current rate.
OK, and what sort of measures will we be using to do that? Because there's speculation this morning that pharmacies will be involved as well. Yeah,
pharmacies are already involved. So, you can already get your booster jab at pharmacies as well.
Something interesting that Jonathan Van Tam was talking about yesterday and in the last few days as well, quite a bit unknown about this Omicron variant. So much we don't know was the quote from Jonathan Van Tam. Do you think there is a concern that, given we don't know how effective the vaccine will be against this new variant, that all the eggs are being placed in one basket?
No, we're doing what we can do with the tools that we have available. So, I think that the vaccine has, so far given protection, and as they think it'll give some protection, but we'll just obviously need to give the scientists that couple of weeks to work out, just how effective it is. And of course, we also know that they've said in the past that, they would also have the capability to tweak vaccines in the future. But right now, we don't have an awful lot of information. But we are doing everything we can, which is just to build that wall of defence as high as we possibly can, which is why we're bringing forward the booster jab for everybody over the age of 18 and for younger cohorts to get a second dose as well.
It's been great to speak to government ministers almost every day on this programme during the whole sort of phase of the pandemic for quite many months now. And one thing that's come through on a lot of those interviews is about learning lessons from the past. I wonder, what do you think is the one thing that you learnt last year that will aid you this time round in terms of implementation of dealing with this new variant?
I think probably the things we've learned are to work together. So first of all, working together with the scientific community, that's been really important. So this new variant was identified extremely quickly, and we could take action extremely quickly, and that's obviously because we've been working with those international scientists. The other thing is to learn to put things in place quickly. So obviously we put the travel restrictions. A couple of more countries went on the red list, so we did that very quickly. And to communicate with the British public as well, and you know, I think the most important thing, and this is for everybody really, we are really all in this together. So what we're really urging is for people, if you haven't had your first dose, please come forward. If you haven't had your second dose, please come forward. And your booster jab, if you're eligible, come forward and please take it as soon as you're asked. Because really, that's all we all want now. All we want for Christmas, I guess, is for everyone to get their jabs.
Can I ask you about mask wearing as well? I don't know if you've seen this, but the MD of Iceland, Richard Walker, and also Co-op say they are not going to ask shoppers to wear masks if they're not wearing them in their shops. What did you say to that this morning?
Well, it is actually the British public's personal responsibility to follow the rules, to wear the masks. And obviously shopkeepers have done an absolutely brilliant job of keeping our shelves supplied and under very trying circumstances. And we thank them for their service and everything they do. And clearly there has been occasions where, you know, that's been confrontational. So, you know, we have a lot of sympathy with that. But really it's for the British public to please be sensible, please wear your mask. But it's really the police who would enforce that. OK, so it's OK for Iceland and the Co-op to say that? Well, I mean, obviously, you know, their job is to stock our shelves and serve us food and, you know, make sure that we can buy food. I understand. I mean, I heard Richard Walker this morning and, you know, it's not their job to police it, is what he said. I mean, obviously, he said they'll put signs up and ask people to respect the rules and to the law and to wear a mask. And, you know, that's reasonable. But really, it's down to individuals. We're all in this together, you know. It's not for everybody to be going round, being policed by shop assistants. Not at all. We all have to do the right thing.
And that is an interesting point because lots of people will be making very personal decisions. And you mentioned Christmas a few answers ago. You know, what is your advice? What would you say to those people who maybe this morning are awaiting their third dose or their booster jab and they are clinically vulnerable or they find themselves to be at higher risk? What should they do in the coming weeks about things like attending Christmas parties, about going to Christmas plays, about attending social events? What's the government advice around things like that?
Well, we're basically saying, you know, we're being proportionate and balanced in our response, but continue with your Christmas plans. You know, we don't know, as Jonathan Van Tam said yesterday, we don't know an awful lot about the virus, about the vaccine, about this variant. So we do need to wait for the information. But, you know, be cautious. I think people who are extremely clinically vulnerable are very cautious anyway. You know, they continue to wear masks. They continue to, you know, consider where they go and make sure that they have the right arrangements in place. Be sensible. Do what you feel comfortable doing. But we're not telling people, you know, to not continue with their plans. We very much hope that we can continue with our Christmas plans. But of course, we're putting these measures in place now to build up our wall of defence.
Julian, Keegan, appreciate your time. Thank you.
Thank you.